exploring the pros and cons of text messaging patients. Check out our website for the infographic. Text messaging has emerged as a valuable communication tool in the healthcare industry, allowing physicians and patients to connect more efficiently and conveniently. Physicians often face challenges in managing their time as they have various responsibilities, from providing preventative services to adhering to guidelines and delivering patient-centered care. Medical transcription outsourcing services serves as a valuable solution for EHR documentation, relieving physicians of stress and enabling them to document more time to patient care. While there are notable benefits to using text messaging in patient care, it is crucial to be aware of potential risks and ensure compliance with privacy regulations. In this infographic, we explore the pros and cons of text messaging between physicians and patients, shedding light on the advantages it offers as well as the challenges it possesses. Number 1, improved communication. Instantly share healthcare updates and results. Enhance patient-physician interaction during recovery periods. Facilitate weight management, diabetes management, medication management, and wellness support. Reduce phone calls, which of course I got one during this podcast. Minimize interruptions and frustrations caused by frequent phone calls. Replace simple tasks like appointment reminders with text messages. 3, it's convenient and time-saving. Quick and efficient communication with patients. Multitasking capabilities for physicians while waiting replies. Enhanced physical patient experience. Improve appointment attendance and reduce no-shows. Provide written records of important pharmacy and healthcare information. But there are security risks. Lack of encryption and SMS compromises patient confidentiality. Violation of HIPAA regulations and protected health information PHI is shared without consent. Risks of misinterpretation and miscommunication in electronic messages, or even verbal, as you've heard throughout this podcast. And onboarding challenges. Obtaining patient consent or receiving text messages. Ensuring compliance and using secure channels for transmitting PHI. The safe transfer of PHI should always be prioritized, and utilizing HIPAA-compliant medical transcription services can help ensure EHR documentation for when talking sometimes is too difficult and texting is just easier. Thank you. Have a good day.